I would say let's go ahead and get started, and if anybody
Okay,
can just introduce them when they get here.
sounds good. Okay, first I apologize to everyone for the late start and the confusion. As I was saying, I think it may be the first time we ran 2 concurrent meetings, and we may not have had the technology down pat for doing so. So I apologize. Hopefully the 2 people that we're missing will be able to join us. So I just want to briefly say a couple of words. First, thank everybody for taking the time to be here. Greatly appreciated. And just talk about where we are and how we got to this point. We've changed the format a little bit. We have than we did for the first 2 meetings. Just to remind you, the idea for these meetings was hatched back in June or July. We had no clue by the time we held the first meeting, we would already be in a situation of crisis where we're seeing an outbreak. So we made a quick change in the format, and we used the first 2 meetings to be primarily an opportunity to share information because things were changing so fast. All of us were struggling to keep up with the changing developments. Now that now that we've arrived at a more stable place, we want to get back to the original thought of these meetings, and that was to really give the students a voice in talking about how we can prevent what happened. And even though we've moved on from what happened, we have a whole year ahead of us. We have the rest of the fall semester. We have hopefully when the college opens in January for the spring semester, we want to make sure that no type of outbreak happens again. I think we're all on the same page as far as that goes. And all along, it was felt that the students' voices were very, very important in hearing their ideas on everything we can do to stay healthy and keep everybody else healthy. So today what we're going to do is take a few minutes to meet with Dr. Diane Jorgensen. She's the City Health Officer. She'll say a few words just generally and informationally about I guess, the virus and precautions and risks. And then she will take questions. And after any questions are answered, we will then move to a dialogue, which will be facilitated by Colleen Brannon. And the dialogue will be just a discussion, hearing primarily from the students about what is the best way that we can work together in making sure that the behaviors that we need to take are taken, and the behaviors that we don't want to take are not taken. So, and the ultimate goal is keep everybody healthy and keep the school open. So with that, I'm going to turn it over to Dr. Jorgensen.
So thank you, everybody. And speaking of technology, I'm now going to try to share my screen as I give you just a brief run through before we have a dialogue. So are you seeing my screen? Okay. So big picture. We know we are in the midst of a global pandemic. This is from the World Health Organization. As of yesterday, there are over 32 million confirmed cases worldwide with close to 1 million deaths. And the reason I put the graphic up is so that you can just sort of see it's not going down. The averages for each day have been pretty steady in the last month or so. It may shift country to country. India had a huge peak and now they're coming down a little bit. Cases are rising in Europe, but overall the pandemic is still with us in the world. Here in the United States, this is CDC data from a couple days ago, over 7 million cases and now over 200,000 deaths. You can see we had the early rise in April, of which New York was a big part and player, but then again, cases creeped up in the summer, came down, and now they're perhaps inching back up a little bit. New York State has done overall well, and this graphic, it's not super clear because all of the blue has to do with the testing that's being done. The yellow is actually the outbreak that happened in New York State, but that was very significant. We had almost 500,000 cases and over 33,000 deaths. All that happened, most of which happened in a very condensed time frame, which put a huge strain on medical facilities, especially in the metropolitan region. So as you can see, since July, the cases have been pretty low, averaging maybe 500 to 800 a day, but and with lots of cases, with lots of testing being done, the positivity rate had until lately been well under 1%. But just today in the New York Times, there was an article speaking to the fact in New York City, the positivity rate is starting to go up. Otsego County, we reported our first case on March 23rd and our first death on March 28th. The first cases that we saw were actually, people were quite ill. And as of August 20th, in the entire county for the entire pandemic, we had only had 116 cases. The first students from SUNY tested positive on August 25th. And as you can see from this graphic there, and as we all know, there was a big outbreak. As of today, from the County Department of Health, the county has now had a total of 883 cases, over 700 of which are linked to the SUNY outbreak. Importantly, in the last 4 days, there have been 15 cases. So I think the point I'd like to make is that, yes, we had a big outbreak by and large. It's resolved by and large. There hasn't been significant community transmission, and all of the people up at SUNY are to thank for that, as well as all our county public health people. But we are still having cases in the community in the county, and I think that's, you know, the virus is still present. We have to be mindful of that. This number of 726 total cases in Oneonta was from actually yesterday. Probably it's a little bit more now. So you can see in the county now, Oneonta, because of the outbreak, has been the focus of cases. So let's talk about the outbreak a little bit. I think that I put this up just to show that, you know, the outbreak occurred in this younger age group. And this has been happening, you know, all over the country and the world in the last few months. The black is the median age of cases confirmed. Well, that's tests, and then confirmed cases in the blue, and see how that's gone down. But I would point out that this line is the people that go to the ER. So yes, the median age of people testing positive and being confirmed cases has gone down, but the people that are getting sicker are the older ones. Again, numerically here, you can see over 20% of cases are now in your age range, 18 to 29, whereas very few deaths are in that age range. Good for you. But the concern is, where can that go? And here's an article that was distributed by the CDC last week, where they showed an increase in older people becoming infected after these younger outbreaks. So I'll just read this. During June through August, COVID-19 incidence was highest in persons aged 20 to 29, which accounted for greater than 20% of all cases. Younger adults likely contribute to community transmission across the United States in June. Increases in percentage of positive SARS-CoV-2 test results among adults 20 to 39 preceded, meaning they came before, increases among those aged over 60 by 4 to 15 days. The implication, therefore, being strict adherence to community mitigation strategies and personal preventive behaviors by younger adults is needed to help reduce infection and subsequent transmission to persons at higher risk for severe disease. So again, not that we don't want students becoming sick, we don't. It's just be mindful of the fact that a lot of students getting sick can potentially transmit that in the community, and older persons are the ones at greater risk for severe disease and death. So, how does a virus spread? I think we all are aware it's primarily a respiratory virus. It's an RNA virus that enters our body through the mucous membranes of the nose, mouth, and even the eyes, and then replicates there and causes infection and disease. In most cases, finally going into the lungs, but also affecting other parts of the body. You've probably heard some debate over whether or not it's droplets or these large particles that don't travel very far and then fall to the ground versus aerosols, which are the smaller particles that can linger in the air. Either way, transmission can be prevented by masks. And I show this slide to emphasize face masks are the most important, powerful public health tool we have to prevent transmission of this respiratory virus. Showing here in simple form, there's a high probability of transmission if a carrier and a healthy person are without masks. With a mask, low probability. With both wearing masks, the lowest. And again, other factors, of course, weigh in, distance, things like that. Another point I really want to get across is that probably at least 50% of transmission occurs in people that do not yet have symptoms. Okay, so I think I don't have time to review all the data that will impress upon you that as a public health measure, mask use works. There is that data, and here is an example. There have been lots of modeling studies that you may have seen, and here's one from the University of Washington. And you can see here the purple is the cases, projected cases, and if we went on, and this is now right at the end of September, if we kind of went along as we were, they would steadily increase. If we started easing mandates, meaning requirements to wear masks and social distancing and that sort of thing, the prediction here is the cases would rapidly increase. If everyone wore masks, you can see this line here, the numbers would go down. So in addition to masks, distance, of course, has to do with spread of the respiratory droplets as well as potential airborne transmission. So these are the two things that we really address in the public health arena. And many of the mandates by state and local governments have to do with people gathering, people being close together, what we call social distancing, as well as mask use. These things are very important too for individuals, covering your mouth when you cough or sneeze, not touching your face after you've touched your outside of your mask, for instance. Cleaning and disinfecting, washing your hands, those are still very important and can help reduce the spread because the virus very readily breaks down with soap and water. And if you say touch the outside of your mask or touched a surface, washing your hands should provide good protection. And then I just want to say, I don't know how to get people to wear their masks, but I think a message that I've tried to impress upon you that if it's not for your own health, if you don't believe you're going to get sick, you really want to do it on behalf of this community and your community. And I'll leave you with how to go about having the peer pressure or the inspiration or the creativity to get that message across. So at this point, I will take any questions, and I'm going to stop my screen share. Nobody has questions. Emma.
I hesitate to interrupt the hopeful note that you left that presentation on, and I certainly hope that there is no cause for the statistic to exist. But if it does, I would be interested to know, is there a statistic for the number of deaths that have occurred in Otsego County related to COVID-19 since the outbreak at SUNY?
Yes, there's only been one since then, and it was not related to the outbreak.
Okay, thank you.
You're welcome. There have only been 7 total deaths since the pandemic began in Otsego County, and most were early on.
So I wanted to ask more specifically on one of the graphs that you showed where there was a red dotted line that had a significant increase, and you had traced that with your mouse when you said that would be the anticipated result if there was a mandate.
Let me go back. I think that it meant if mandates were eased, if restrictions were eased, there would be an increase. Is that,
Okay.
did that make sense?
The phrasing of it was sort of counterintuitive because it sounded like you said if there was a mandate put in place that it would continue to increase, and I was confused as to how that.
I'm sorry if that wasn't clear. I think that I meant if the mandates were not there, if they were eased, that's
Okay.
what happened. Colleen?
Diane, really appreciate the overview, just to see the global, the US, you know, to bring it down to state and county. Thank you for sharing all of that.
Okay, you know, just to follow up on Emma's question, we are really thankful that there were no deaths by anybody of any age and no very serious illnesses that I'm aware of as a result of the outbreak. Part of that was a lot of hard work by a lot of people. A lot of people did the right thing quickly, as well as each individual person, whether young or old, that did the right thing by wearing a mask, social distancing, avoiding gatherings. So it took a lot of people, you know, when you think of it, having over 700 people get the virus in a community, and we stopped the spread before anybody got very, very sick or worse, died. That's really remarkable. And that took everybody doing the right thing, which we're very thankful for. So Colleen, turn it over to you. I think you'll lead a discussion about hearing, you know, what are some of the best recommendations of how we can go forward and stay healthy?
Thank you, Mayor Herzog. So Dr. Chambers and I and the students met Friday afternoon just briefly. I wanted them to have some time to process and think about just broadly. I asked them some specific questions, but I told them broadly that we would be convening so that we could all collaborate and work together for the best interest of both our students and the residents in the city, obviously in town too of Oneonta. And so what I'd like to do is just share the questions again and open it up so the students can share some of the ideas that they did with us on Friday and maybe some new ones that they thought of over the weekend. I was really encouraged by our conversation and their creativity and their enthusiasm. So here are my questions that I presented then. I said that we would want to talk about finding effective ways to encourage social distancing, hand washing, wearing masks, not for these students who sort of preaching to the choir, but to the students who don't seem to be doing that right now, or residents. I want you to think about ways that we could prevent large gatherings, in particular in downtown Oneonta. And thirdly, some ways that we could campaign or message around these things, as well as getting the word out that SUNY Oneonta is hosting COVID testing for both on-campus and off-campus students every Monday moving forward this semester. So that's what I threw out to the students, and I'm gonna open it up and let them share things that they did already or things that they've thought about over the weekend, and you'll probably be as impressed as I was. So. Go for it, Emma.
Okay. Well, one of the things that we had talked about that I really appreciated was that town-gown relationship, and that this absolutely requires, you know, total buy-in from the entire community, and that there's going to be a lot of work that goes into rebuilding that relationship. And so a lot of these ideas and decisions have to sort of function on two levels. One level, achieving everything that you just mentioned, but also, you know, onboarding the entire community. So one of the first things that came to mind when thinking about that, that I had mentioned on Friday, is that one of my favorite things that SUNY Oneonta does is to provide safe social opportunities for students. And typically the goal of that is, Friday and Saturday nights, providing opportunities on campus that are in a safe and dry environment. And I've always appreciated that service that the campus provides to students. And I think it's exactly the same mentality that the campus can take in terms of providing safe social opportunities in the face of a pandemic. So that's, virtual social activities and strictly supervised in-person activities that, happen on a very small scale, outdoors, marked social distancing, and the more opportunities for socialization that is safe, the less that, students are driven underground to, engage in unsafe activities. And one of the things that we acknowledged that I think is incredibly important to acknowledge is that humans are fundamentally social creatures, and college-age humans are even more so, exponentially more so. And so if they are on campus, and if they are in spaces with each other, those sort of opportunities have to be provided, because it's going to happen one way or another, whether there's structure and hopefully safety or not.
Okay.
Oh, also, I'll just add one more thing to that, sorry. The more that those opportunities could potentially involve other community members, more fun sort of things like trivia nights where community members can join as well, or a lecture series. I know that a lot of SUNY Oneonta's events are open to community members in general. And I think the more that we can keep that up, and the more that we can create spaces where all community members can interact with students and just with each other, I think that that will be wildly restorative.
Thanks.
Can you hear me? Yeah.
Sure
Right.
can.
Just making sure. So another thing that we mentioned was, because obviously our relationship between, the school and the town has been somewhat strained during this whole outbreak. So something we mentioned was some more like kind of PR moves that we can make to kind of bring unity to the two. And we thought of maybe, taking some photos, wearing masks, showing social distancing, but with community members and, SUNY Oneonta residents who are still here, especially like shop owners or store owners or something like that, where we can show that, we are trying to practice, safety, and we also want to stay unified as one, because obviously one cannot function without the other. The town needs the students and the students need the town. So we just want to show that unity through some simple PR, pictures or whatever.
Mm-hmm. Go ahead.
I was just going to say, related to that, something that I've been really impressed by, I think it's in collaboration between the library and history department on campus. They've been compiling student stories specifically of their own experiences during the pandemic. I think it's called the Pandemic Diaries. And I think that that could be opened up into a larger project with the community as a whole. And I'm not exactly sure what form that takes. I don't know if that's text. I don't know if that's more of an audio, sort of oral history type format, or what. But I think the more that people can tell their stories and hear their stories, I think the more that both students and other community members will be able to see all of the commonalities that people are experiencing right now. That we're all pretty lonely and we're all pretty scared, but the vast, vast, vast majority are just doing our best to keep everybody safe.
Emma, if I remember correctly, I think you had some folks in mind to work on that, including you. Am I remembering correctly?
Yes. Oh,
I think that was Rachel, maybe.
Okay.
it was me, and then Olivia, the VP of Events and PR, and then you mentioned someone else to work with. I think it was like the president of commerce or something like that, some title like that.
Oh, the chamber president.
The chamber president.
Chamber president. or Al Rubin, who is our alumna.
Also, serving on this committee, like as a student from SUNY Oneonta, it like really gives like members in Oneonta like a platform to really like connect with community members, especially on like the call we had like before this. So I happened to be on the YouTube page with like all the calls from Oneonta, like the city of Oneonta YouTube, like where the calls are like recorded and posted. And I noticed there are a lot of different like committees and commissions, and I was wondering if like these control groups could be open to all students on campus, or like student leaders, and like having like a diversity of like different ideas and stuff coming from Oneonta. And like as students, we do live in the town, and like I'm sure like there can be a lot of good like ideas stemming in, such as like the Commission on Community Relations and Human Rights, I believe. I noticed on the meeting like there were a lot of spots, and like as I was watching, I was like, oh wait, like we could do it this way. And even though like I wasn't like physically in the call, like I just thought like students might have like a lot of good ideas to bring to that, and like that would be a good way to like restore community relations too. And like it shows that students actually do care about the town and like the well-being of it.
Mayor Herzig, are there other, at our meeting on Friday, Maham was talking about the Human Rights Commission and other city committees. Are there any city committees that you think would be great to have students join? Are there any openings at the moment? Do you have any thoughts on that?
Well, first, Maham, I think that's a terrific idea. And even though we may not have openings, I don't see why we can't have a guest slot for a student on each commission. And you know, you'd be surprised. I'm sure there is somebody on campus who is interested in zoning. There's always somebody interested in something. And
Gary, would we as a council have to make a change anywhere? Can you think of any change we would need to make to be able to make that happen?
You know, I think they could be a non-voting member. This way they can partake in discussion. They can introduce ideas and thoughts.
Yeah, because if we did that, they could be actually at the table with a conversation versus being the public where they can only talk in the beginning.
Yeah, no, that's what I mean. Yeah, absolutely.
That's a good idea.
So I think that's a great idea, that we make at least one chair available, virtual these days, for a student at each of our boards and commission. And I'm sure that we'll have somebody interested in every one of them. And I think that's a terrific idea, and we'll do it.
That's great. Other thoughts? I know they have many more. They're just getting started.
I can add another. Diane, I loved those like sandwich boards that were at the end of your presentation. And I think that kind of positive messaging and, you know, tossing a little humor into it is the name of the game. And as much as, you know, the college can put that messaging out within the campus and within the larger community, I think the better. I work at the Science Discovery Center, and we had, you know, prior to everybody going home and it becoming more of a moot point, we had created a graphic of Batman. There's a line in The Dark Knight Rises where he says, "The mask is not for you, it's to protect the people you care about." And he was wearing a mask, and that's a great line. And I think that really exemplifies the messaging that encourages empathy rather than guilt for not following your own, not protecting yourself. And I think as much as that messaging can be personalized as well, like I am so grateful to hear that there you know, were no deaths related to the outbreak on SUNY's campus. But I think that, you know, making sure that students remember that there are other community members who are at a higher risk, you know, as per your graphs that show that students aren't necessarily at a risk of death, but that older community members are. I think that, you know, as much as we can be reminded as students that there are folks who live at, have lived here their whole lives. One of the phrases that students occasionally say, and I haven't heard it for a while, and I'm grateful for that, and I've only heard it a few times, but I've heard Oneonta isn't real. And I know that that's a testament to, just feeling like a sort of like a transient population, we're only here for 4 years. And I think that if there can be larger messaging about what an opportunity to be a part of this amazing community for 4 years, rather than, that Oneonta isn't real sort of message. I'm losing my way a little bit here, but I'm saying the more that we can encourage students to engage with the community positively, the more that'll trickle into everything, including pandemic safety.
Thanks.
Another example I was just thinking of, an idea would be if we take maybe local businesses like, say, Domino's, because I know Domino's used to be very like involved with student life. I remember Ramon, if anyone knows him, he was like the Domino's guy, and he would come and he would give students free pizza. So maybe we can do something where, you see someone walking down the street with a mask on, oh, here's a free pizza, or something like that. Like, maybe we can involve local businesses to do something like that, like give them like a coupon or something, like kind of a positive reinforcement for, like, following safety guidelines or something. Like maybe that was all I had to say.
Oh, and I was gonna say, like, just to jump off Rachel's point, like another small business that many students are like inclined towards is Oneonta, the clothing brand. So like maybe we could reach out and like ask them, like, would you be interested in like creating masks, and like students would actually like be interested in purchasing them and like wearing them. But definitely contacting like small businesses, and like the quick quirky quotes that Emma had said, like creating them into posters and just hanging them around town, like hanging them in the windows of small businesses in front of like Main Street, just to like conditioning the students to see the message and just like, like end up wearing the masks.
You talked about quite a few good ideas on Friday, and I think I've got some notes someplace from that meeting about who volunteered for what. So I'll try to put that on paper and send it back out to the student group to see whether I have that right or not. Let's see. Kevin, how about you? Do you have anything you want to add?
I've had just a couple of thoughts brewing around. I know some of the stuff that I had thought of earlier was a little more controversial, but it kind of gave a behind the scenes look at how some students are handling it, with the sentiment that Emma expressed and the fact that we are appreciative of Oneonta's past adherence to enabling good social gatherings for college students in a regular year that isn't a pandemic. It would be nice for the college to continue to do the same, and I believe they have with the virtual meetings that they have had. I went to the one with Bill Nye. It was an enjoyable night for me after the long meeting that we had. I think it was almost immediately after a control room meeting. So I do enjoy that. But with regards to what some students are doing and have been doing, I've both seen and heard different instances of breaking the rules, but in a responsible way, in that, in town, there's going to be a gathering of friends at a house, and I don't think that there's anything explicitly wrong with that. But whether their restriction is you have to be wearing a mask the entire time you're inside, or you need to show me the test you got this Monday that said you were negative, that you got the results on Thursday. So there was a very small window of opportunity for you to become contagious. Students, to my knowledge, if they are hanging out, aren't being completely reckless or willy-nilly with the situation that we're in. So if it was any reassurance to a member of the public or anybody on this board to know that students are being mindful in one sense or another, I do think the degree obviously can always be improved upon. But just to give some insight further on that. There was something Emma had talked about that I cannot recall right now, but I did want to comment on it. If it comes back around to me, I'll make sure I mention it.
Dr. Georgeson, go ahead.
I feel like I need to respond to that. I think it sounds like students are making up their own rules. Having a negative test does not mean you do not have to social distance, because you can be negative today and positive tomorrow. There's no assurance, even if you've had it and recovered, that you couldn't potentially, although it's unlikely, but none of the guidance, none of the laws give you permission to not wear a mask if you're not a family member or within 6 feet of someone. So I like that you think the students are being creative by coming up with their own rules around this, but I think it's important for you to know that that's not valid, either from a health perspective or from a legal perspective.
And while I'm completely aware that the test obviously is a snapshot in time, that it's not at all the solution that should be made, that you're right in the sense that it's, I suppose if you want to phrase it as making up your own rules. I'm just not sure exactly what the difference would be between a group of friends being in a household with their mask off, opposed to being in a restaurant in town with their mask off, if there was just the seating.
Well, the restaurant guidance is pretty specific. If you can't eat and drink, you know, with a mask on, but at all other times, even say if you were a student, say that you had tested all the students and they had negative tests and were on campus, they'd still have to wear masks and socially distance in the classroom. So testing does not get you around practicing all the rules that we have in place. And, you know, part of the hard part around that is who is your family, right? Who is your, perhaps people in houses have determined that they're a unit or a family or a pod, and they're not gonna socially distance or wear a mask. But then to invite other people in and consider that reasonable, I think, is faulty thinking.
I think what Kevin has presented for us is a challenge that as members of this community, we need to figure out ways that we can help students to socially engage in a responsible way. Kevin has presented ideas that the students are obviously practicing that is contrary to what our guidance says. So I think that as members of this community and this control group, that we should have these type conversations frequently so that we can develop those robust activities that Emma mentioned earlier that are structured, that can take place outdoors, where masks could be worn, but that students can continue to socially engage. I think that it would be almost insidious of us to think that young people are not going to socially interact. In fact, it's not healthy for students to not socially interact and socially engage. But I think as a community, it's incumbent upon us to figure out those ways that are responsible so that we can help our students and other members of the Oneonta community engage socially in a responsible and safe manner.
And also, sorry, go ahead. Okay, and also, you know, related to, in addition to snappy one-lined messaging, more in-depth messaging, making, you know, Diane, your points clear in no uncertain terms, you know, of what best practices are in the eyes of science and the law. And that can be done in a snappy graphic too. You know, that's making it very clear that, you know, you have your pod, and if, you know, just because you're in under a roof, you've invited new people in, it's, you know, you've created something different. So as much as that messaging can be very accessible, you know, ideally, you know, graphics involved, not just a list of bullet points on a web page somewhere, you know, something that people are confronting daily in a way that they, you know, want to engage with. I think that that's an approach that needs to happen.
You know, I just wanted to point out that students are not alone in trying to figure this out. We are all, no matter what your age is, and trying to figure this out. You know, I can tell you the people I know, my friends, are going through the same challenges of who's in my pod? How many people can I safely have in my backyard over, tonight for having some snacks? If we don't wear a mask, how close can we be to each other? I mean, we're all struggling with this, trying to figure it out. It's not very easy, particularly when you're dealing with an invisible enemy that's unpredictable. So it's a challenge for all of us to try to be cognizant of what the rules are, what the risks are, and how much we can feel safe doing, and how much we can also not get ourselves in trouble by breaking rules. And the other thing is, the rules aren't always sensible and fair. And, people are always pointing out inconsistencies and why can you do this, but you can't do that? Why can somebody do this, but somebody else can't? And that's part of the challenge, because try to imagine changing the behavior of every human being in the state, let alone, at the same time with very little time to plan for it. It's hard to get rules that work perfectly. So this is a challenge for all of us to figure out.
Other ideas, especially around gathering safely. And I agree, I struggle with it as well. I'm a social being. I want to be with people. It's really hard to figure out how to do anything. And I think it's actually going to get harder as we have to go inside. Right now we're lucky. We can be outside. I've had friends over on my front porch because we can social distance outside with 2 other people. It's large enough for that, but as soon as it gets colder, it's going to be even more challenging. So are any of the students, are there any things that you're doing now that you think are following the guidelines? Are you doing anything virtually with friends? Or I'd love to hear something that's going on successfully.
One thing that I've found that's been working really well, I'm living with 3 other people, so that's been my house pod. Yep, and we eased into it from our family pods. We all isolated when we got here, and then after 2 weeks we became a new pod. But one thing that I found is working really well for us is that we've been virtually calling other house pods. So we'll have our house all on the screen here, and so you get that immediate feeling of being around people physically, and it's safe because we're in our pod, but you get to talk to other people. And we'll have a screen with like 3 groups, and that works really well because you have that immediate feedback, but you also get to talk to new people. And I've been trying to create events around that, so we're going to do like a pumpkin carving night like that. And I think that could be implemented for a college setting if, whenever dorms are a thing again, with a 2-person roommate on a call. So you have that person that's next to you, but you get to interact with other people, and it's 100% safe. I don't know how you really crack down on like, are you actually living with that person? And I don't know really what form that takes, but that's just something that's been working for me.
Mm-hmm. Dr. Chambers, when we talked on Friday, I think you had talked about the importance of keeping the students, this group meeting separately, just to talk about these kinds of things, like different events, and just get more ideas.
Certainly, I think that it's important that we continue to engage this group of students in particular, because they bring so many ideas to the table, and it's apparent that they are committed to both the city of Oneonta and our campus community. And if we can figure out ways where we can bridge that gap and serve as bridge builders to making our relationship better with the town, that's all for the better. I think my biggest takeaway from this meeting and our meeting on Friday is that the students are interested in a campaign around safety, and that they want that campaign to go beyond just the campus. And they want the city to be involved. They want the merchants to be involved. And I think what better group to help formalize some of those ideas than these bright young people who've shared so much with us in such a short time, that we need to harness this energy in the most positive ways and bring some of these ideas to fruition rather swiftly.
Another thing I wanted to share, I don't know how, I'm assuming we're going to run out of time pretty soon. So another thing I wanted to share from our conversation on Friday is that the students had other concerns. I told them for this meeting that I wanted to stay focused on just the health and safety of the community and our students and the partnership, and, you know, just have the students get to know all of you a little bit. But I think we have other topics that need attention. And I just wanted to share a few of those. And Mary, you can, we can maybe talk later, or maybe you'll decide this with your council members, what other topics we should do and what timing. But I know we had talked about having some engagement between the students and Chief Brenner. We had talked about the students talked Friday. I talked about sort of town-gown relations, and that it's pretty typical in a college town for there to sometimes be tension over different issues. That obviously students who like to stay up till 2 in the morning and, you know, sleep till noon, living next to families who have children who get up at 6 a.m. and need to go to bed at 8 o'clock, there's obviously a lot of tension. And so I think we've given the students an opportunity to let their voices be heard tonight. And I think it's just as important to allow our residents to do the same. So maybe that's an appropriate, maybe there are some residents that can come and share their point of view at a future meeting so that the students can be here and just listen and hear their concerns. I know you wanted to have some conversation about transportation. And I think we need to continue the conversation, most importantly, about how do we keep the students that are off campus safe? How do we really tackle the large gatherings? I don't know whether we've got an answer for that right now. And I'm interested if anybody else, both students and officials, if you have any thoughts on things that we could be doing, because I'm not sure we have that solved.
So I'll jump in and kind of just ask 2 questions to help clarify what we're talking about in terms of what the current reporting or frequency of a large gathering has been as of recently, as well as what is deemed large opposed to just a gathering of people.
Yeah. Mayor, would you bring that?
Let me try to answer that. I'll answer the second question first as to what's a large gathering. You know, we follow the state law. The state law states that you can have no more than 50 people at any gathering, any place, indoor or out. However, obviously, that's a large number, a very large number, a too large number. So the other side of it is you can have no more people than can be at least 6 feet apart from each other. So in other words, in any size apartment or house, there cannot be more people than would cause a problem of every single person being 6 feet away from another person. Now, obviously, that's a tough one to map out and measure, and we're not able to do that. So we do depend upon the police when they're enforcing that to use their judgment. And, you know, they're quite experienced at doing that, because even in non-COVID times, they deal with at what point is a gathering considered unsafe because there's too many people. So it's something that they normally deal with. So they use their judgment. If they feel that there are too many people in the house, that could be considered safe, and they're not or if they're not wearing masks, they will then issue tickets because it's not a safe gathering and it goes against the public health law and a new ordinance that the city is going to be passing. The other question about what has been the occurrence of unsafe gatherings recently. The very good news is that we have not been having a lot of gatherings in the city, which have been problematic, at least that we're aware of. Now, how many take place that we're not aware of, I don't know. There was that picture that was on social media a week or so ago of a gathering. Our police were never aware of it. People who were doing it only got caught because they were foolish enough to post pictures of themselves on social media. So gatherings happen, I'm sure that we don't know. But the good news is we have not had a large number. Now, of course, as weather gets colder, it's harder to know what's going on inside a basement, inside houses. Windows are closed, you don't make as much noise. So there's going to be a challenge. And then the other part is, as everybody gets more acclimated, feels safer, hasn't seen anybody get sick in a while, people do what people do, and they ease up. So, but the good news is we have not been having many problems lately, Kevin. That is good news.
Maham, did you raise your hand?
No, I didn't, but we are currently working on an initiative where like students are going to send pictures in of them wearing facial coverings, and then we're going to probably share it on the Oneonta SA Instagram or another like platform such as the school's website, just so like students can see that like we're actually taking this seriously and it's something that like we're doing as a community, and it's like not like we're singling anyone out or like, yeah.
It's great.
Sorry, excuse me. Something that I was thinking about was, because you were saying, well, what can we do, to avoid these gatherings? And just a point I'd like to make is I do think that one of the reasons why maybe these social gatherings happen is because there isn't that alternative of, and this is only for the upperclassmen, of course, but we used to have the bars open that could safely, like you have your certain number, your pod, and you can go out with your pod and do that on a Friday night, safely with those precautions that, the establishment has set forth, rather than, going and sneaking off to a party. So I feel like that we also have to keep in mind, the limitations that, people have because certain establishments they're not allowed to be open. So that's just something I thought of.
Rachel, you make a very good point there because, one of the unintended consequences of having the bars required to greatly reduce their capacity is it drives people to party elsewhere where they're less visible. So it's a tough one. It's a real balance here we're trying to achieve, but the bars are restricted by the law, but that does create a problem that sometimes you're better off having people be in a bar where there are rules, there are laws, it's supervised, it's visible, than have people go into a basement. Dave.
Dave.
You're muted.
That was bound to happen to me at some point today with all the Zoom meetings I've been on. I think that as far as trying to restrict large gatherings, I think it's going to be an uphill battle. I think Gary's right, though, that there's been far fewer of them. And Rachel's correct about the bars. We knew back in August that with the limitations they were going to have, it was going to force more students into the neighborhoods on the weekends. I think one thing I completely agree with, and I don't know that there's been enough of this. Honestly, I don't. I'm glad we're talking tonight about it, but I think that giving the students the ability to socialize safely, giving as many opportunities as possible is one tool to solve this problem. Maybe somehow trying to come up with more incentives for this than normal, because I know in any normal year there's lots of things going on the weekends. But as far as stopping the large social groups, part of what drives it too, it's kind of a downward spiral, is when you add the alcohol in, then your judgment isn't quite as good, which means you do something that you may not normally do, and then as you drink more, you know, everybody knows what I'm talking about. So maybe one other piece of this that we need to address is trying to come up with a social campaign where, you know, if you're going to drink, you're going to have a drink on the weekend. Try not to drink as much. Try to keep it toned down so you're able to social distance, and that you don't do something that is going to help spread COVID to you, your friends, your family members, and so on. Because I don't think we're ever going to stop students from drinking. I mean, I know it was like that when I was in school, no matter what we do. And students are very social, more so than their older counterparts in some cases. So maybe coming at this from a different angle and trying to just have the students try to control what they do a little bit more on the weekend might help too.
Okay, we're probably running out of time now. We don't want to go on too late, but this has been really excellent. Thank you. You know, a lot of positive ideas, and you know, we don't want to try to beat this by enforcement, because first of all, we don't have the ability to enforce our way out of this because we have a police force of 25 people. They can't cover all the ground that they would have to cover to totally enforce this. Enforcement is only one tool, but it's not the best tool. And we want to use some of the ideas that you've generated now, which are much better. Enforcement is the last straw to have to go to. So these are great. Colleen, we have to find a way now to take these ideas and to make sure we don't lose them and turn them into action plans of how we're going to implement them.
Okay.
It would be that
I'm not
easy.
saying I'm going to do that single-handedly, but my plan after this meeting is to try to pretty much bullet some of the ideas that came out of this meeting, and I'll send them back to the students to make sure I've captured them in a way that they're willing to engage in. And then I mentioned before, Dr. Chambers was willing to meet with the students, but I also was going to ask Mayor if we can have some outreach with folks at the city to also be engaged in. I'm not sure how the social media piece is going to go or be. I know that the college communications staff at the moment is completely up to their eyeballs and with a lot of things. So we've got to be creative and figure out how we're going to do this. So I'll get the ideas on paper first, and then I'll be calling lots of people to ask them to contribute in different ways. And, you know, we'll take a few things at a time. We aren't going to conquer the world overnight, but we need to do our best to tackle this collaboratively.
And there's a lot of the items that were on that list that are designed to be done in cooperation between community folks and college folks.
Yeah.
So
Absolutely.
we definitely want to do that because it'll be much more effective in doing it that way.
I agree.
Also, lastly, while we were talking, I was thinking of another kind of like initiative that we can do with the local businesses, is that because we're trying to think of ways, you know, to stop like the partying in the basements. Maybe on like Friday nights they can have promotions that would, you know, encourage like students like, oh, let's go to like Applebee's. They're having like this promotion like on a Friday night. Let's go there in our pod, and like, you know, then there's like, again, that expectation of like there's the establishment there and they're not gonna like break any rules there. So maybe that could be also something we could look into.
Mm-hmm. That sounds good.
Okay, this has been really, really worth the time, so I really appreciate it. It's a great start. It's only a start. We're going to try and meet every other week, or we're going to skip a week because of the holiday, Columbus Day on October 12th. So we're going to meet next on October 19th. That'll give us enough time to figure out how to do two concurrent meetings on Zoom.
Yeah.
And get it right the next time.
Okay.
So I want to thank the 4 students that managed to reconnect, and my apologies to the 2 that didn't. And I want to thank Dr. Chambers. I want to thank Colleen Brannon, Dave Risberger, and of course, Dr. Jorgensen. And the plan for the 19th is we're going to have Police Chief Brenner participate. So you'll be able to communicate back and forth with him, ask questions, give ideas, and we'll base the discussion around the police's role in all of this, which we would like to be the smallest role.
Okay.
Okay. Thank you. This will be posted on YouTube, so it'll probably go up later tonight.
Okay.
Thank you all.
Thank you, everybody.
Have a great night.
Great night.
Thank you.
Thank you. Good night, everyone.
Thank you so much. So grateful to be a part of these conversations.